Sherman type 1 femoral avulsion of the ACL can be treated nicely with repair of the ACL. Previously, we used to use the knotless technique of the ACL repair. Now we have modified the technique using the very low profile osteoknot X anchor in this scenario because it gives a very guided and you can tension the knots as per your need, and the fineness of these threads get you the best possible repair. Here we are preparing the femoral footprint of the ACL tear, and you can do a bundle specific repair. You can repair the anteromedial and the posterolateral bundle separately, and you can use two osteoknot X anchors here. 1.7 now this is a very mm anchor which is loaded with number 0 UHMWPE fiber, which is very unique as compared to any standard anchor which comes with a number 2 wire. So these are very low profile sutures which can be used to repair the flimsy torn bundles, specifically the anteromedial and the posterolateral bundle separately. So here the first anchor is inserted for the anteromedial bundle, and the second anchor is inserted down for the posterolateral bundle. So what it will does is it will lead us repair the torn fragments of the bundles separately, and you can individually tension. So you can see the two anchors here, and now at this stage we will shift our scope to the medial side, and we will be passing the sutures through the lateral aspect so as to pass the sutures sequentially. So we are passing the sutures sequentially one by one, and by doing this we are able to achieve a very good bundle specific repair in this circumstance. So what we are doing here is we are passing the sutures one by one. Occasionally the suture management can be difficult here, but if you do it carefully you will be able to do it nicely separately, and you can individually tension the bundles here. So this is the first suture which is very important, and this is for the posterolateral bundle, and this will give you a very nice fixation of the posterolateral bundle, and this is very important for the rotational stability. And after that we will tie the suture for the anteromedial bundle, and this will give a very solid repair for the anteromedial bundle. So what we are doing is we are trying to repair bundles specifically separately, and this will give you a tension which is adjustable and the tension that you can titrate as per the need for both the bundles, the anteromedial and the posterolateral bundles. And these are very low profile suture limbs, as I told, and so you will be able to titrate the tension, you will be able to repair the sutures, and the chances of cut out or cut through of these wires are very minimal as compared to the standard knotless technique. So when you do this technique properly, you will achieve a very nice healing, and usually the internal brace is not needed when you use these kind of fine sutures, because this will lead to a very good repair of the ACL ligament at its place on the femoral footprint. So this is the final suture, and when we tie this suture we will see that whole of the ACL is now repaired onto its footprint in a very nice way. And this is the final picture. We can see that the whole ACL is now repaired, and you can see from the other portal, the lateral aspect, the very nice ACL with good vascularity. And occasionally we can make small holes which is called as a microfracture to increase the vascularity and the healing potential of this ACL primary repair. Thank you.